washing my hands. Come on, guys. Pay attention. So, washing my hands. Hi, how are you doing today?
Good, how are you?
My name is Jamie. I'm going to be your nurse. Everything going okay?
Yep.
Are you having any pain?
No.
All right. So, what brings you here? You don't know?
No.
All right. So what I'm doing is just kind of doing a little assessment on you. Can I raise your head out of your bed?
That
No?
one's broken.
Is it broken? Are you kidding me? Oh, it's
there you
not.
go. It isn't.
You
it
lied to
doesn't
me.
raise up and down. Let's fix that.
All right. So I'm going to ask you a couple questions.
Okay.
All right. So as I'm doing my assessment, I'm going to ask you a little bit of questions. So you said you had no pain at this time, right?
Right.
Okay. So what I'm doing is actually, your skin seems warm. Okay. It's pink in color. So then you've got that. All right. So what I'm going to do is shine some light into you. Okay.
Okay.
What we're doing is we're just going to see if your eyes react to light. Okay, we're going to make sure they're equal and reactive, okay?
Okay.
So it might be a little bright. I apologize for that.
Okay.
All right? So, they're active to light, okay? And so what I'm going to do is bring this back here, and you're going to follow it. And they both react. All right? So they're round, reactive to light, and accommodation, okay? All right. So, I'm going to have you set up because I need to take a listen to you. What I'm going to do is take a listen to the backside. I'm going to listen to you breathe, okay? So, I want you to take breaths regularly every time you feel my stethoscope on you. Take a deep breath out in. Hold it for a little bit. I don't have it.
Oh. Well,
And breathe out. And then let it out, okay? All right? So, take a deep breath in. And let it out. In. And let it out. Good job. So everything sounds great on the backside. So your posterior, what you're doing is you're listening for breath sounds. Shallow, normal, and she's doing great, okay? So then you would listen to the front side, and you will do the same thing on the front side. So you'll listen up here, and then you're going to work your way down, okay? So you're going to hit the upper and lower lumps, okay? I'm not going to do it, but just so you're, okay? So what I'm also going to do is listen to the 5 areas of your heart, okay? So what we're going to do is we're going to do the aortic, the pulmonary, the herbs, and then you're going to go the tricuspid, and then the mitral, okay? So just remember the mitral is just right at the nipple line, and then sometimes you'll have to go underneath the bra, okay? So then you would just listen, and what we're doing is you're gonna just relax. You're not gonna take any deep breaths. I'm just listening, okay? And then, sorry about that. I'm gonna get in your personal space. And then it's under. And then you're going to go back over here. And it usually is at the bra line. Okay. Alright. So also, I am actually just going to look at the pulses too. Okay. So you do, remember you're going to do the carotids one at a time. Right? Because you don't want to, do bad things. And we've already checked our radio. All right, so can you lean back for me? Okay, so you've got the femoral, which is right in your growing areas, okay? You also got the post, okay, on both. So what I do is actually just the grabbing, and then you're going to lift, and then they're right up here, okay? So once you mess with people's feet, wash your hands. Just saying, okay? All right, so I'm going to actually have you get in the hood. Gotta raise your shirt.
That's in the bed.
So we're going to lean you back down. All right, so what you're going to do is the abdomen. You're gonna make sure, so we're going to raise her shirt up, you're going to look at her abdomen. You're going to make sure that it's symmetrical. You're going to make sure all 4 quadrants look, symmetrical. So are you having any pain in your abdomen?
No.
All right. So everything looks good. You have a rash right there.
I'm allergic to nickel.
Okay, see? All right, so you assess, and then you're going to listen. So you're going to listen to all 4 quadrants of the bowels, okay? Sometimes, like I said, you won't hear them. You won't hear them. You'll have to listen for a full minute. So you can, both sides, you'll listen both sides of your bowel, okay? I'm just going to, for the purposes, I'm just going to use one, okay?
When we do the checkup, listen both sides.
She's active. Not real active. At least it's not yelling at me. Alright. That one was, that side did.
Yep.
Okay, so then at this time, after you assess, auscultate, you'll palpate. And I know you guys aren't doing the percussion, but then you percuss afterwards. So then you're gonna tell me if this is sore, okay? It's a little sore. So what you're gonna do is work in the quadrants and just make sure that everything's okay, okay? Just as a little tender. Yep. And then you ask, this is where you can ask is, how's your bowel movements? You having a bowel movement? Urination? Any troubles urinating? So that's when you would ask that, okay? All right, so then we're going to assess your motor skills, okay? So you can either, depending on whether they're in the bed or what, you can actually move their legs, How's that feel? Any pain, tenderness, or anything? All right, and then you just get them to stand up. Are you able to stand up?
Yes.
And I can't do that, so you're kind of... Oh, are you sure you can stand up? All right, so then this is where you would say, you check their gait. So you want to do the nice little, good job. All right. We're just checking gait. All right. Any questions, guys? Quick assessment. What's it?